Thank you all for coming to the event, talking about our bladder and bowel today. Someone walked in and said, "It's the pee party," and that's why we're here, right? I'm Lindsay with Medtronic. I've been working with Dr. Cady for many, many years and stuff, and we're all glad you're here. And then that is also my work partner, Shar Swan, and we're happy that we can be together today.
Yeah. Awesome. Thank you, Lindsay. Thank you, Shar. You guys, I'm Dr. Cady. My wife, Rachel, and I are both obstetrician gynecologists, and we've been coming to Mora for the last 10 years now. We graduated from medical school in 2000, went to residency in Michigan. After residency, we moved to Crosby, Minnesota. So we've been in Crosby our whole career, and we've been grateful for the relationship that we've been able to establish with the hospital and clinic here. It's been an awesome pleasure to take care of everybody here in the community. So, and it's humbling to see so many people here and so many people signed up online. I know everybody's busy, so thank you for taking time out of your busy schedules to be here. I'm here for you guys tonight, so stop me along the way if you have questions. If you have questions that are of a more personal nature, I'm happy to talk to you in private, or you can always schedule an appointment too, of course, and we'll spend as much time as you guys need to go over, any concerns that you have. So my main thing, and Rachel, my wife, would say the same thing, is we just want to help you. So whatever you may be struggling with from, urinary bowel symptoms, I'm assuming that may be why you're here, or maybe know a loved one who is struggling with these problems. So tonight is just a night to really give you information. So, knowledge is power, and just so that you can kind of take control of your symptoms. I think for a long time, unfortunately, patients have been told, well, it's just part of the aging process, and it's just kind of what you have to live with. And I want to scream like, no, that's not what it has to be. You have so many options available. So one of the things that I like to always tell my patients is be patient, be a patient, work with us, because the first thing that we try might not work. And so there's this process that we work through, and to not give up. The first thing we try, it might not work, but then we go on to the next thing. And that might not work either, but we'll go on to the next thing. There's so many different treatment options that it's very unusual that we get to a point where we say, I don't know, we've tried everything. We may not be able to achieve the kind of results we were hoping. That's very unusual. So what is more common is that we find something that works for you. So, but again, thank you for being here. And I'll get started. So again, kind of speaking to what I just said, this is not something you have to live with. And the very first slide is a patient testimonial. This is a patient who has been struggling with urinary symptoms and chose to pursue a therapy that we'll talk a little bit more about in this talk called InterStim. This is a therapy that's been out since 1997. Shar and Lindsay are the reps for this product. So we'll give this a try here. And can you guys hear me okay? You can? Oh, okay. Sorry. Yeah, let me know if I need to All right. So again, that was a patient who chose this InterStim therapy, which we'll talk a little bit more towards the end of this talk. So, most of the patients we see have said these things to themselves or to us as their physician. Will I ever regain control? Can I ever attend an outdoor celebration? I'm afraid to leave home without having an accident. Can I ever wear white pants again? How can I possibly go on a date, get a job? And the bathroom is always on my mind. We call it bathroom mapping, where you just know where every bathroom is. You're restricting your fluids. You're afraid of having an accident, and it's what's always on your mind. This is just amazing to me. Like, more than 64% of people that experience symptoms are not currently using any treatment or product to manage their incontinence, or if they are, it's most likely pads. And then many patients don't move beyond that point just because a lot of times they assume that there aren't any other treatment options available. So, and then 48% of people with OAB, which stands for overactive bladder, reported loss of confidence. So bladder and bowel issues aren't inevitable. So again, this is what I was saying, like, this is super common and it isn't normal, and it's, not right to just be told that, this is just something you have to live with. It's not. There's a lot of good treatment options. So, do any of these sound familiar? Urinating more than 8 times a day, getting that, oh man, I gotta go. Like, I'm afraid I'm not gonna make it to the bathroom. Planning your activities around the bathroom, monitoring how much you eat or drink, using pads to control leaking, and then getting poor sleep because you're getting woken up at night to have to go so often. And you're not alone. This slide, I think, is important because, as you can see, it's super common. So right here, you can see bladder control problems affect 1 in 6 US adults. So that's 43 million people. And bowel control problems is 1 in 12, so 21 million. I think it's important for us as providers to ask our patients about these problems because of the nature of the problem. If we don't, understandably, our patients won't often bring it up because they are embarrassed. But we never want you to be embarrassed. We're all patients at some point in our life. Look, all we want to do is help you feel better. So definitely talk to us about these things. We want to be able to help you. And I think finally, I sense that this is starting to get a little bit better. I think patients are starting to talk more amongst themselves with their family and friends, knowing that they're not the only ones, that there are other people out there struggling with these same problems. So the good news is, as I mentioned, there's lots of good treatment options. So we'll go through these now. So what causes bladder and bowel control problems? So sometimes it can be as simple as your diet. Sometimes it can be certain medications that you're taking, can also be related to childbirth, causing injury to the pelvic floor. So I'll just, in terms of diet, so some of the things that we see most commonly would be caffeinated beverages. So caffeine is a diuretic. It makes your bladder fill up more quickly. I think we all know this from experience. Same with alcohol. It's a diuretic. So, if our patients are drinking a lot of alcohol or caffeine, that's a place to start. It's easier said than done. I mean, you may enjoy coffee like I do. I think if I was ever told I had to stop coffee, it would be a sad day, but sometimes stopping or cutting back will help significantly. Medications, so probably one of the medications that we see most commonly would be like hydrochlorothiazide or Lasix. Patients are on these medications for swelling in their lower extremities. Sometimes they're used to manage blood pressure. So potentially an easy fix with that is just to have a conversation with their primary care provider, seeing, can we get her off of this and onto something else? And sometimes that's just enough to help. So those are some things to consider. In terms of pelvic floor injuries sustained at the time of delivery, that's where physical therapy can be really helpful, and we work closely with our physical therapists. So this slide is just showing that there's this complicated communication system between our bladder and our brain, and when that breaks down, that's when some of the problems that we're going to talk about start. And I'll talk more about that with some future slides here. So now, what are the common types of incontinence that we see? We see stress incontinence, we see urinary retention, we see overactive bladder, and we see fecal incontinence. So let's talk about each one of those individually. So what is stress incontinence? This is super common. We see this a lot in all ages. Patients in their 30s sometimes, all throughout the end of life ages. And what I tell my patients is that stress incontinence is actually not so much a problem with the bladder as it is a problem with the support under the urethra. So I'm going to use very basic diagram here using my fist. So if my fist is your bladder and my finger is your urethra, which is the tube from the bladder to the outside of the vagina, when you laugh, cough, or sneeze, that generates intra-abdominal pressure, and that causes your urethra to move. And the only thing that prevents your urethra from moving excessively is the support tissue under the urethra. So if these three fingers are the support tissue, the urethra rests on that support. And that's super important because it's necessary for your urethra, the tube from the bladder to the outside of the vagina, not to move very much in order to maintain continence, to not leak. If that tissue is weakened, either through aging or some people inherit weaker tissue, or from childbirth that tissue got damaged or weakened, then patients develop what we call a hypermobile urethra. That urethra moves excessively, and that causes incontinence of urine. So in terms of treatment options, probably the two best treatment options for treating stress incontinence is referral to physical therapy so they can teach our patients how to strengthen their pelvic floor muscles. And that can really help to reduce or eliminate their stress incontinence. In fact, some studies have shown that 80% of patients will experience improvement. The reason why I think physical therapy is so important is it's not intuitive, knowing how to contract those muscles. So physical therapists can do what's called biofeedback. They can work with you to teach you how to contract those muscles, and then you just go home and then on a daily basis do them to maintain that good pelvic floor muscle strength. If patients have either tried that or they want to, or they don't want to do it, then the next probably best option is a surgical procedure that my wife and I do called a sling procedure. That's where we use a small piece of mesh. It takes about 20-25 minutes. Patients go home the same day. The mesh is very thin and about the width of Scotch tape. It's made out of a type of material called polypropylene, and it's like a interwoven fishing line. And so again, if this is your urethra and this finger is the mesh just loops right underneath your urethra. And this procedure has been out since the mid-1990s and is an excellent procedure for women who struggle with stress incontinence. So the success is about 90%. So again, that's stress incontinence. Now, Medtronic, the makers of the InterStim, we'll talk about this, but that procedure is not for people who have stress incontinence. It's for people who have urge incontinence, also people who have trouble emptying their bladder and fecal incontinence. So that's why it's so important for us to see you as patients in the clinic so we can first of all determine what type of incontinence do you have, and sometimes it's a mix of both. So urinary retention, this is when you can't tell if your bladder is full or not. And you might feel like, wow, I feel like I am not emptying completely, or your urinary stream is super weak. This can be due to a poorly functioning bladder. Your bladder is just not wanting to squeeze like it should. It can also be due to obstruction. So for men, the most common cause of obstruction and cause of urinary symptom is an enlarged prostate. But for women, the most common cause is what's called pelvic organ prolapse. This is where the vaginal tissue begins to bulge and bulge out towards the opening of the vagina. And so what happens oftentimes in those cases is that the urethra, again, gets kinked from the tissue bulging down, and it creates like an obstruction. So this again is why it's so important for us to see our patients in the clinic so we can determine, is there prolapse? And if so, then we can offer, sometimes a pessary, which is like a little ring that can help hold the vaginal tissue up and take away that obstruction, or we can discuss like surgical management too to correct that. Sometimes that's all we have to do to help with their urinary symptoms, is to correct the bulging that is occurring. Okay, overactive bladder. This is the, I have got to go, I'm not going to make it. Oftentimes you don't make it, you have large amount of leaking. our bladder muscle is a passive muscle. It's not normally contracting throughout the day. It should just be passively filling. And then when it gets to a certain fullness, it'll send a signal to our brain saying, hey, when it's appropriate, go to the bathroom. And then once you're in the bathroom, it sends a signal back down to your bladder saying, okay, you can contract now. And then it contracts and pushes that urine out, and the process starts all over. The problem with patients who have overactive bladder is that communication pathway has become, it malfunctions essentially. So the bladder just takes on a life of its own. It's no longer communicating with the brain like it should. So you're out and about, and all of a sudden the bladder just says, I'm going to contract. And that's when you feel like, oh, I got to go. So the InterStim that we've been talking about is an excellent therapy for this, for patients who have tried other things that haven't worked. So there's kind of, like I said, this process that we work through, and sometimes we eventually get to that point where we're talking about InterStim. Fecal incontinence. So again, you saw this is so common. I mean, one in 12 patients. So this is, that you can have the urge fecal incontinence where like you'll eat and you'll feel like, oh, I got to go, and you can't make it in time. Or sometimes patients will experience just leakage of stool without even knowing. There's a variety of reasons why this may be occurring. Probably one of the more common reasons, though, is probably obstetrical injury, so a bad vaginal laceration at the time of delivery, then eventually over time can start to lead to trouble with fecal incontinence. I'll just say now, and I'll talk more about this, but InterStim is an amazing therapy for fecal incontinence. Before InterStim, and people are still doing these surgical procedures, but they're quite involved, a longer recovery. InterStim is super minimally invasive, very low risk, and has a super high success rate for treating fecal incontinence. So it's an excellent therapy for patients who are struggling with this problem. All right, so find more control. There are many ways to treat incontinence and get back to living life. So lifestyle changes, oral medications for the bladder, and then advanced therapy. So let's go through these. So we talked about diet already. We talked mainly about beverages, so caffeine, alcohol, those are kind of the two main culprits. In terms of food, it's going to be mainly like acidic, and we have these handouts for our patients, so it's always good to know, like maybe there's certain foods that would be best to stay away from, like just acidic foods in general, tomatoes and those types of things. Exercise. So exercise is important to maintain good, healthy weight, but also to keep your core pelvic floor muscles strong. And then physical therapy is so important, just to teach you the biofeedback, how to contract the right muscles and strengthen your pelvic floor muscles. So we start with that. Then we can either do that in combination with medications, or we can just start with, dietary modification and physical therapy. But then, I think it's important for patients to start with medications. There's several available to choose from. They don't always work. Like this slide says, one survey showed that 72% of people said they stopped taking bladder medication within 6 months. So that's a high number, but it does mean that about 30% had good, results. So I think, like always, we should at least offer this, of course, because it may work. Like all medications, they have potential side effects. Probably the two most common side effects that we see with bladder medications is constipation and dry mouth. And I would say about 10% of patients will experience those side effects to the degree that they say, I got to stop. It's too affecting my life too much, the symptoms that I'm having. It's also important to say that once you stop the medication, those side effects will go away. So other things to consider, especially in patients who are, maybe in their 70s or older, some studies have shown that it can affect your memory. So you might not notice, you might start to notice that it's just harder to recall things. So of course, that's a concern. That's also something that would go away once you stop. It also can affect your gait and make you feel a little bit less steady with your gait. There's some newer medications that are out. One is called Myrbetriq. Another one is called Gemtesa. Myrbetriq is the one that can cause hypertension or high blood pressure. So in patients, especially who have uncontrolled blood pressure, it's not a good option. And Gemtesa is a good medication too, but unfortunately, like these medications are covered oftentimes, but sometimes, like as you guys all know, newer medications when they roll out sometimes are prohibitively expensive. But so medications, again, can be a good option, and we should always at least start with that for our patients who have overactive bladder. Okay, so those are the conservative treatment options, and then we'll kind of end by talking about advanced therapy. So what does advanced therapy mean? So when we're talking about bladder control, that would include the Medtronic InterStim system, which again has been out since 1997. That's when it was approved by the Food and Drug Administration, put out by Medtronic, a Minnesota company here. And then the Medtronic Neuro system, and then injected medications. So for bowel control, like I mentioned, there's other surgical options, but really I think for patients who are having fecal incontinence, they should always start with InterStim. It's the least invasive, less risk than the other procedures, and has a super high success rate. Okay, so Botox. What is Botox? We've all heard about Botox with the Hollywood stars and getting rid of wrinkles. We actually use Botox for the bladder, and it can work really well. So this is a treatment option that we will offer to our patients. The way that this works is we place a little camera in your bladder, and we inject in multiple different locations in your bladder the Botox. And that just kind of relaxes your bladder muscle and can work really well. But one study did find that 67% of patients discontinued treatment after their first Botox injection. So just like the slide with the medication, I mean, it's not for everybody, but I do think for patients who want to try it, it's worth trying. If, like, for example, they didn't want to start with InterStim, they could try this procedure. If it did work for them, then it usually wears off 4 to 6 months after. So then we have to have you come back and repeat the injection. When it works, it's great. When it doesn't, we can try other things. The one thing that I do mention to my patients with Botox is about 8% of patients will have difficulty emptying their bladder after the Botox injection, to the point that they might need to, for a short period of time, do catheterization at home. We call it a straight catheterization, which we can teach you how to do, and it's easy to do, but it's always important for us to explain that before we do it, so it's not a surprise if it happens. And it's transient, so it would not last forever. It usually only lasts for a few weeks to maybe a month, and then as the Botox starts to wear off, patients are able to empty their bladder better. So this is also like InterStim, well, not like InterStim, but made by Medtronic. It's a type of what we call neurotherapy that can help patients who are struggling with overactive bladder symptoms. And it's called Neuro. And the way that it works is, surprisingly, you wouldn't think this, but your tibial nerve, which is down on, by your ankle, ties into the nerve network that supplies innervation and sensation and function to your bladder. So they have found, and it's been shown in studies, that patients who have stimulation of this tibial nerve can have good relief of their bladder symptoms. So some patients choose this treatment option, especially if they're maybe not a very good medical candidate to undergo anesthesia because of certain health conditions, or they just are nervous or afraid about anesthesia. They can have this done in the office. It is something where you come in, we place a little needle down by the ankle, and you do that for 30 minutes once a week for 3 months. After the 3 months are up, we determine, has it worked or not? Have you had at least a 50% improvement in your symptoms? If so, then you continue on with the therapy, and that's once a month for 30 minutes, usually indefinitely. So it's that time investment. So that's called Neuro. So that's an option in addition to all the other things that we talked about. And then lastly is InterStim. So InterStim is truly awesome. Like my patients will ask me oftentimes, like, if I were your mom or your sister, would you recommend this procedure to me? And I say absolutely, without hesitation. Again, I don't think it's the first thing you should start with, but if you get to a point where you've tried other things and you're like, am I going to have to live with these symptoms for the rest of my life? I would say no, likely you will not. Like, InterStim is a great therapy. I think ideally, like me being a surgeon, I want to be able to do a procedure where the potential for success is super high and the potential for surgical complications is super low. And InterStim is that procedure. It's very, very low risk and has very, very high potential to help you with your symptoms. What this picture is showing is, maybe some of you have pacemakers or know somebody with a pacemaker. It's a super small battery that for people who have pacemakers is up here. So for patients who choose to have InterStim, basically what we are doing is, let me see here. Yeah, so I'll kind of go through the procedure a little bit just so you can understand what we do. But this is a procedure that's done back in the operating room. We give you sedation. So you're not under general anesthesia, but you're very comfortable. You won't remember it. You'll be like, what, we're done already? And so in the operating room, we use a type of X-ray called fluoroscopy. And that helps us place this little tiny flexible wire near your nerves by your tailbone. Once we feel confident that it's in the right position, and we have different ways of determining that in the operating room, then we secure the wire with like tape, and we wake you up and we send you home. And we give you a little iPhone device that is really awesome. It has all these things that you can use to keep track of your symptoms. They, let you record all these different things. But every day then for the next week or two, one of the reps from Medtronic will call you to see how are you doing. We want you to tell us that you've had at least a 50% improvement in your symptoms. So if you're struggling with overactive bladder, we want you to be saying like, wow, I was like going every hour. Now I can go like 3 hours and I can comfortably get to the bathroom without feeling anxious that I'm not going to make it. Or also like I was getting up 8 times at night and now I'm getting up 4 times at night or 3 times at night. If you're having fecal incontinence, obviously we want to see less incontinence or complete elimination ideally of your incontinence. And same with urinary retention. If you're like, wow, I feel like I can really empty my bladder a lot better now. So those are the things that we're wanting to hear. And if we are like, oh, unfortunately, it seems as though it didn't work for you, then we just remove the wire. But what more commonly happens is that patients do truly have improvement in their symptoms. And then what we do is we bring you back in a week or two for a second procedure. The first procedure can take anywhere from 30 minutes to 45 minutes usually. The second procedure is shorter. It takes about 15 minutes. The second procedure involves just making a very small incision over the mid portion of your buttock, and we implant that little battery that we're showing you. It attaches to the little flexible wire. So ultimately, everything is implanted under the skin. You don't have anything that is exterior that can catch on your clothing. So that's InterStim. That's how it works. When they first made InterStim, it actually was not MRI safe. Now it is. So this is great news because we would have patients sometimes who would come to us and say, oh, I need an MRI, like I have really bad back pain, or they're thinking about maybe needing to do surgery. The only way that they can determine what they need to do is to get an MRI, and they were having really good results with their InterStim. So we'd have to remove it, then they have to get their MRI, and then we'd bring them back and replace it. But now it's MRI safe, that's awesome. And the 1.53T, that just means that those are different. T stands for Tesla. It's just different. It's a way of measuring the strength of the magnetic field. So even with our most advanced MRIs now that have the stronger fields that give us better images, this InterStim is safe for that. So this is a really good advancement in the therapy that you don't have to remove it now. You can have an MRI with it in place. And it, oh, what else was I going to say? It seems like I was going to say something else about InterStim, but yeah. So anyway, so this is, I think, the last slide, but this shows you, again, how effective it is. So if the writing is kind of small, but the first one says 84% satisfaction among those who use it for bladder control. 3 times greater improvements in quality of life compared to medications. 89% of people using Medtronic bowel control therapy experienced long-term success. So you can see these numbers are super high. Like patients experience good results with this, both with bladder and bowel. And it has proven efficacy. I mean, a lot of patients have had this procedure since it's been introduced, over 400,000. Oh, I remember the one thing that I wanted to mention is the battery life. When it first came out, it was about 5 years. Now the battery life is about 10, sometimes longer, depending on how low the settings are. And when the battery goes out, you would find that you would start having your symptoms come back. Then you'd come into the clinic, we would check the device, we'd find that the battery is no longer functioning or is very low. And then we'd bring you back for a 15-minute procedure, remove the old battery, and then attach the new battery to the InterStim wire. There would not be a need to remove the wire. So, and the last slide is this patient testimonial. InterStim therapy has given me freedom from searching for restrooms or worrying about embarrassing moments. One thing you may want to write down, I think this is really good, is the InterStimAmbassadors.com on the Medtronic website. What that allows you to do is to talk to somebody who has chosen to have the InterStim therapy, and you can, just hear what their experience has been like. And lastly, if you guys want to write down, well, again, if you are interested in seeing myself or my wife Rachel, of course we would be happy to see you as patients to discuss, any questions that you have in more detail. Stacy is outside, so she can schedule you for an appointment if you'd like to do that tonight. Otherwise, I apologize, it's not on the slide, but I can give you the number to call to make an appointment, and that is 320-679-1313. So again, it's 320-679-1313 to make an appointment. I think that's all I have, but I mean, I'm happy to take questions if you guys have any, but yeah.
So how many of the general population's insurance covers most of the cost?
Yeah, that's, I would say, as a physician, I will rarely hear that it's not covered. I don't know if even I can remember, somebody not having it covered. If we, it's expensive, if you were to pay for it out of pocket. And in terms of the cost that would be responsible to the patient, that's going to depend, on the insurance plan too. So, and how big their deductible is.
And how often are you or your wife here in the clinic at Moron?
Yeah, good question. So we operate 2 times a month. So on Mondays, and I'm here every other Monday. So then I'm here on the days that we're not operating in clinic. So I'm here 2 days a month in clinic, 2 days a month operating. My wife and I operate together on most of our cases, our bigger cases. Then my wife Rachel is here every Tuesday. So there's 6 days a month where you could see either myself or Rachel. So. Yeah.
Well, I'm here because a friend of mine has come to you, I believe.
Oh, okay.
And she, at our girls' gathering, if you could get a word in, she was telling me about some procedure and basically the lifting of the bladder.
Oh,
making sure it doesn't cause any pressure.
Mhm.
She used some of the same words that you did, but I can't tell you exactly what she said.
Yeah.
And she so far has seemed very pleased with it.
Oh, good. Yeah.
I didn't even know you were here.
Oh, really?
But I know the phone number, how to get to the clinic. Everyone knows that, right? 1313.
Yep. Oh. Yeah.
I was wondering how this would affect people who have heart disease.
Yeah, that's a good question. So it won't affect their heart at all. I mean, prior to undergoing any surgical procedure, we always need to do a preoperative, history and physical and make sure that it's safe to move forward with surgery. But the device itself won't cause any cardiac problems or heart problems. Yeah. Yes.
In that wire, what if you travel a lot, like out of like Mexico,
Mm-hmm.
and you've got a problem?
Yeah. Well, so if you're traveling down to Mexico, anytime you're traveling, you're always going to have a card with you, and it will say that you have an implantable device. We just ask that you turn it off when you're going through security and turn it back on. And that's very easy to do. And we can teach you and show you how to do that. Medtronic and we are always happy to take any phone calls. So, worst case, if you had an issue with it when you're in Mexico, you can always call somebody. We won't leave you out to dry. We'll take care of you. But I can't, like any surgical procedure, right afterwards, this is a very low risk for infection, but any surgical procedure that we do, there's always potential for that. So it wouldn't be something that I would recommend, traveling to Mexico, like within a week or two after surgery, just in case that were to occur. But once it's implanted and you've gotten past that point where, an infection could occur, you won't then get an infection, like a year or even 6 months down the road. That won't be something that would happen. So I would feel very comfortable with you traveling even out of the country with it. Yeah, any other questions that you guys have? Oh, yes.
I have an implant for my back, just like that.
Mm-hmm.
I would be able to have.
You could still have it.
Can you?
Mm-hmm. Yep, you sure could. Uh-huh, yep.
On opposite sides.
Yeah, we would place it. It would be away from where your current device is. Yep, so that would still be an option for you. Yeah.
Would this
Yeah.
interfere with your pacemaker?
No. Mm. Yes. Yeah, good question. So you can, there's different program settings and different intensities, and we can change that if necessary. But usually what happens most commonly is we get you on a program and in a certain intensity that is working for you, and then it's just kind of autopilot and you don't have to make adjustments. But if for whatever reason we do need to make adjustments, we can do that. Yeah, any other questions that you guys have? Those are all good questions.
I had no idea about this program.
Yeah,
Zero, none, never.
I think it's kind of a bummer because we hear that quite a bit. And, like I said, this has been FDA approved since 1997. And it's a little bit of a mystery to me, to be honest, why it's not more well known. Because it'd be one thing if it was a procedure where the effectiveness was kind of like, it's kind of a flip of a coin, But this is a really good, I mean, honestly, when patients are like, what would be a reason for me not to consider doing it? I mean, about the only thing I can think of is that it just might not work for you. I mean, the reality is it doesn't work for everybody. It does work for most people, but it doesn't. So, there's always going to be the patients that we try it because you never know unless you try it. And they just are like, oh, it's just not as helping as much as I want. But that is definitely the minority. The majority of patients have really good relief with this procedure. So yeah, I don't know. It's a little bit sad to me that it is still, although I think this is starting to change, but it's like taken a long time for people to become. And I think if I were to guess, part of it is probably the nature of the problem. Like, I think that patients have for a long time felt really isolated in the problem that they have with their incontinence, with urinary incontinence, and probably even more so with fecal incontinence, because they're embarrassed about it. So, you know, like if you're with your friends and you have diabetes or high blood pressure, that might come up in conversation. Like, I've tried this med and I've tried that med and this has worked for me and that hasn't. But it's a lot more like you're going out on a limb to be like, I'm having trouble with leaking. And do you guys, you know? And I think patients are afraid to say that. And I think what they'd find is if they do say that, most of their friends would probably say, I actually am too, as you can see. So I think that fortunately, patients are starting to realize that this is super common. So they're starting to feel, but you know, again, tell your friends and family, like, even if you don't feel comfortable talking to your friends or family about the problem, encourage them to come and talk to us, you know, because we see this all of the time. Like, it is so common. And so I think, you know, one of the reasons why it just hasn't been, you know, widely known for such a long time is people haven't been talking about it. So, but hopefully that starts to change with you guys coming to events like this and spreading the word to
Well,
your
the
friends.
population is women.
Yes.
And a lot of us have the same issues or similar ones.
Oh, online question? Okay. Oh, sorry. They should not. They should be able to see us directly. Yep. Mm-hmm. Yep. Did you have a question?
When you talk about adjustments, you have to come into the clinic to have the adjustments made.
Yeah, we'll always see you in the clinic, but you know, you can call Medtronic, the Medtronic line, and they'll help you, right? Is that correct? Yeah. Yeah.
You can just do it over the phone. They can make adjustments over the phone even.
Yeah, yep. And I'll say this, like, total shout out to Lindsay and Shar. They're our Medtronic reps. They're here for the procedures, and they're here to walk you through it. And we are very blessed to have both of them. They are awesome, and they take such good care of our patients. So, you know, we never want our patients to feel like, I had this device put in and now I'm having some questions and I don't know who to call. That should never happen to you, and it wouldn't. We would always be there for you to answer questions. So, yeah. So, did you guys want to say anything to that, or?
And I too also afterwards, if you want to put this kind of one-on-one. That questionnaire that when you came in today, you've got a booklet, and then there's a packet or a little things that were stapled together. If this is something where you think you might have some additional questions or concerns, if you fill that out, I will be calling people hopefully over the next few days to follow up after tonight's event, answer some additional questions, because sometimes you think you left here and you're like, oh, I should have asked that question, but I forgot, or I didn't think of it soon enough. So Lindsay and I are the experts in InterStim. So we're here for you. And again, like Dr. Cady referenced, we're here for the long haul. So it's not something where you have surgery and then you're done. Lindsay and I are in this area a lot. So we can see you in clinic if Dr. Cady is not there on the day. If we need to come in and see you on a different day because he's not here, we can do that. We just work with his staff very closely to help support you because we always want you to be successful. You know, you go to all this work, surgery, family helping you out through things. We want this to be successful for you. So use us, use Dr. Cady, and we'll be here for you. I always tell patients after they've had surgery, if you ever look at, ever say this doesn't work, that's when you come see us. And sometimes it's just we have to fine tweak some things. And the device works great for that. But we're going to show you how to do things, and it works really great. I have like Dr. Cady said, would you have a family member do this? Yes. I'm a nurse for 30 years. 100% I would have my family do this. A lot of success.
Yeah.
Ages? Oh my gosh. So I worked at Children's Hospital, believe it or not. So we can do the therapy for anyone that is 14 all the way up to a 96-year-old. Yeah. Yeah,
That
there is
long
no
ago.
age limit, basically.
It's not common at any age. You want to make that difference.
Yep. It's like, it's hard because a lot of you, if you've been on medication before, it's hard to get to this point. You're like, gosh, nothing's ever worked. Try another thing. But this works. Sometimes you have to get to those things. Yep. To get here. And that is why we're so passionate about the therapy.
Yeah, just, I said it already, but just don't give up, you know, like, it's a process sometimes. So It's not always the first thing we try. So make sure to hang in there with us because we want to get to a point where you're having resolution of your symptoms. Yeah.
I'm saying you should have this done, or would you recommend other things to try before?
Yeah, that's a good question. Again, it's so important to just get your history, see what type of symptoms you're having to try to direct the most appropriate therapy. But we would never start with InterStim, even though it is super safe and super effective. I think it's always important to, pursue the non-surgical options first. But to know that if, medication, for example, doesn't work, then it's, the next step would be to consider the InterStim procedure for sure. Yeah.
All appointments in Memorial, or do you offer in Pine City or Hinkley?
Yeah, good question. So Rachel and I actually only do come to Mora, so it would have to be here in Mora and not Pine City or Hinkley, unfortunately. But yeah. Did you have another
I
question?
do, because my sister is like twice as burdened by the problem. She lives in Lindstrom.
Oh, yes.
However, excuse me. However, I was wondering if there was a video made, I saw on camera, of you doing your speech or your,
That's a good question. Will this be posted on the Mora website, or I don't know? Is it? I don't know the answer to that question. I suppose it could be possible, to. Yeah. Are they are recording it though? Yeah. So I guess we could talk and just have it, as a link to click on, and then she could watch the talk. So that would be easy to do, and that's a good idea. So we'll work on that. That might be helpful
I mean,
to.
I could even.
Oh, Lindsay said yes. So
Email two or something, or a link to it.
yeah.
Okay, because we all have our email addresses on our phones.
Yeah. So, maybe, I don't know what the time frame will be in terms of them posting it, but hopefully it'll be up on the
I mean,
website.
Repeat everything you said and I'll miss 90% of it.
Yeah.
She will understand.
Yeah.
because
Most important is come see him.
What's that?
And so just most importantly, just come and see him.
Yeah, and she, like I say, she's an hour plus away. So I'd have to have her stay with me for a little bit in order to get through this. However, oh my God, it's my sister. Oh, it's okay. I love her still.
Yeah.
That is
We
good.
get the phone numbers for girls here in electronics, so we have those.
Yeah, I think.
So we don't give out our personal phone numbers, because imagine. Yep. We cover northern Minnesota.
Oh, yeah.
A lot of people. So what we can do is, if you have questions or concerns, call Dr. Cady's office. And what they can do is they can reach out to us individually, and we can call you, or vice versa. If you have a question, they will call us and we can give them a response. If you do call, is it identified as an electronic? But I don't answer my phone if I don't know who's calling me. Our numbers are not, of course. But what we will do is we will leave you a detailed message. So for example, if I call you at a follow-up from tonight, do that. My number is a 218 number, whichever is a 218 number, because it's telemark, here you live, 1320. I'll leave a message identifying who I am, why I'm calling, if you have an opportunity, I know. Any other questions that we can help answer for anybody?
Yes.
You talk a little bit about the site for this is going to
Mhm.
sensitive on the outside skin or.
No, so your incision again is very small, and we place it kind of over the mid buttock area. So we want it to not be so high that it's rubbing on your belt line, but not so low that you're sitting on it. So we position in that location, just like a pacemaker. If you felt, you can feel it, but it's not uncomfortable. And same with this. If you feel back there, you'll feel oftentimes, you know, the battery, but it's not uncomfortable.
Is that gonna be?
Nope, you'll have a little, you know, incision scar there, but it's very tiny. Postoperative pain is very minimal. Sometimes patients only need like over-the-counter ibuprofen, Tylenol. We usually send patients home with a few stronger pain meds to take for a few days if necessary, but because the incision's so small, pain is very, very minimal. Yeah.
Yeah, Joe. That is implanted.
Yeah.
And will it, and you have just the bladder problem,
Yes.
take care of the bladder.
Mhm.
And what if you have just only the bowel problem,
Yeah,
then we'll take care of that.
correct. Yeah, it'll take care of.
You don't have to have, if you have the bowel problem, you can have that alone without having that.
Yeah, okay. You're saying that you don't have, you're wondering if you need to have both the bowel and bladder problem in order to have it placed? Or if you could just have one or the other?
Yeah, could you have one or just one or the other?
Correct, yep. So we see patients who don't have any urinary symptoms. They only have trouble with their bowels and they are losing stool. And they are an excellent candidate for InterStim. Does that answer your question? Is that what you were wondering about? Okay, yep. Mhm.
The same nerve controls the bladder and the bowel. So if you have both problems, same procedure. If you have one problem, same procedure. Like it doesn't change. You can have both.
Yeah, I'm glad you asked that because I might not have made that clear. It's not like, yeah, the therapy would, because we see a lot of patients who have both and then they have relief of both their bowel and bladder symptoms. But sometimes they only have urinary symptoms. Sometimes they just have bowel symptoms. So, but it treats all of it. All right, any other questions that you guys have?
I found this very informative,
Good.
and I'm going to make an appointment.
Well,
I'm
good.
ready to be ready.
Yeah, I mean, like I said in the beginning, I'm grateful that you all took time out of your schedules to come here, and that's you know, the main thing for my wife and I is that we just want to help you, you know, and so we're here for you. We're grateful that we've been able to come here for 10 years and help the patients here in this area. We love Mora and we love the providers here, and it's been a great blessing for us. So we're hoping to continue to work here for many more years. And so, but again, if there aren't any other questions, I hope you all have a good night. I'll be hanging around a little bit. So if you want to come up to me and ask any questions, I'm happy to talk to you. Otherwise, Stacy, I think, is still outside. So she'll, you know, schedule you for appointments if you'd like, or you guys have that number that you can call as well.